everyone, welcome to Mentis Measures. Today I am going to discuss about endometrial polyp, which is named as uterine polyp. So without further ado, let's start. First, you have to know what is polyp. Polyp is a tumor which is attached by a pedicle, and endometrial polyp is a growth of cells attached to the inner lining of uterus called endometrium. As you all know, uterus has three layers: outside perimetrium, middle myometrium, and inner is called endometrium. You can see the picture of endometrial polyp here. These polyps are usually benign, can be cancerous, or can turn into cancer. They are called precancerous polyps. Uterine polyps range from a few millimeters, no larger than a sesame seed, to several centimeters, golf ball size, or larger. They attach to the uterine wall by a large base or a thin stalk. If pedunculated, they can protrude through the cervix into the vagina, and it can cause pain. There are two types, benign and malignant. Benign is non-cancerous. There are three types, mucous, fibroid, placental, and malignant is two types, carcinoma and sarcoma. There are some risk factors of endometrial polyp, like using hormone replacement therapy, which actually involves using of large doses of estrogen, tamoxifen therapy, which is used in breast carcinoma. So people who have breast cancer history, they are also in a risk of having endometrial polyp. Then diabetes mellitus, hypertension, obesity, and increasing age is also a risk factor. Now I will talk about clinical features. There may not be any symptoms, but you have to remember that pain is not a common clinical feature of uterine polyp. But following symptoms are related, like irregular menstrual bleeding, bleeding between periods, excessively heavy periods, bleeding after menopause, spotting, contact bleeding if polyp is situated at or outside the cervix, excessive vaginal discharge which may be in offensive smell. Now the sign. Patient may be clinically anemic because of loss of blood, and sometimes you can see a patient of endometrial polyp having difficulty of getting pregnant. Now per speculum examination findings. In mucous polyp, it looks reddish in color, usually attached with a slender pedicle. Fibroid polyp. It reveals size and color of the polyp, usually pale, may be hemorrhagic. The attachment of the pedicle to cervix can be visualized, but attachment higher. Pathogenesis of endometrial polyp. Uterine polyps are estrogen sensitive, meaning they actually grow in response to estrogen. Estrogen plays a role in causing the endometrium to thicken each month during your menstrual cycle. This thickening likely contributes to uterine polyp growth. Complication of endometrial polyp. Infertility is the most common complication, may develop into endometrial hyperplasia, which means excessive thickening of the endometrium, or carcinoma, which is a rare condition. Investigations to find out endometrial polyp. Transvaginal sonography is the gold standard investigation. Then we can do hysteroscopy and endometrial biopsy. This is a picture of transvaginal ultrasound. Sonologist will insert a slim handheld device called an ultrasound transducer into your vagina. The device emits sound waves that provide an image of the inside of your uterus, including any irregularities. This is a hysteroscope. The doctor will insert a long, thin tube with a lighted telescope called hysteroscope through your vagina and cervix into your uterus. The hysteroscope allows your provider to examine the inside of your uterus. During endometrial biopsy, a suction catheter inside the uterus collects a specimen for lab testing. There are some differential diagnoses of endometrial polyp like uterine fibroids, adenomyosis, endometrial carcinoma, endometrial hyperplasia. By doing the investigations, you can exclude this differential diagnosis. Now the management. Some people can ask if any medications are used to prevent or cure this disease. Actually, there are some drugs that keep your hormone balance, like progestins or gonadotropin releasing hormone agonists may be used to relieve the symptoms. But the symptoms usually return after you stop taking the medication. So it is better to do hysteroscopy, and big polyps lying in the vagina is removed by morcellation, also called piecemeal, and hysterectomy, which is indicated when polyps are expected to be infected. You have to remember that polyps should be sent for histopathological examination after its removal to exclude if there is any malignancy present or not. Now the prognosis. Typically good, rarely recur after removal. You may ask, if uterine polyps can be prevented or not. I like to say that you cannot prevent uterine polyps. You can take steps to catch them early so that they don't cause complications or unpleasant symptoms. Getting regular gynecological checkups can allow your doctor to catch polyps early. So, getting regular gynecological symptoms are mandatory if you find any symptoms of endometrial polyp. So, after watching this video, I hope you are informed, well informed about endometrial polyp and its symptoms. So, if anyone have this one symptoms, any of the symptoms, please do visit a gynecologist. I hope you have enjoyed this video. Please like, share and subscribe to my channel for more videos like this. I have also a playlist of gynecology videos. I will put the link in the description box. I have also an Instagram account. Please do follow me on Instagram also. Thank you everyone. Bye.